Hello, everyone. Welcome to Dentistry Dialogues, episode 1 here on Practice Growth. So, my name is Samad. I am a CEO of mConsent SRS Web Solutions. And today we are going to have a discussion on growing your practice consistently. And when you try to grow, what are the roadblocks that comes in when you're trying to grow? So, if you're seeing 20 patients a day, and from that you are trying to get to 30 and you're suddenly seeing some roadblocks, how do we take care of that? That's what we're going to discuss today. Our expert today in the room here is Mr. Daniel Sid. Daniel has over 15 years of experience in dental field. He has managed multiple offices. I know him personally for past 10, 11, 12 years. Yeah. And it's been pleasure knowing Daniel here in Dallas. And he has managed multiple offices from orthodontics to pediatric to general practice, and he know how to grow practices. He have done that, seen that, done that multiple times, still continue to do that. So Daniel does consulting for mConsent, so he's one of our gurus here, and who's better than Daniel to talk on this topic? So we thought of bringing Daniel here in the studio today and discuss growing the practice consistently and how to take care of the roadblocks here. So about Daniel a little bit, not only just manage the practices, but he helps on financial side. He helps and supports practices on accounting, payroll, compliance. He holds an MBA from Pepperdine University, and he's looking to go next to become a CPA and help in taxation for dental practices. So, Daniel, welcome, and thank you for being on the podcast. And pleasure to have you here. And let's get into it, man. So, if you can just give start with like a quick story of how did you get started in dentistry? What brings you into dentistry?
First of all, thank you so much for having me. This is a really nice introduction of you. I appreciate it. Well, my story kind of happened by accident, like a lot of stories, right? My background is actually in pharmaceutical companies. That's how my career got started. But eventually I switched to business.
How long ago was this?
Boy, we're talking about 2005 to 2006.
Oh,
You're giving out my
giving
age, man.
The white hair shows it all.
Exactly. Yeah. So by accident, I became friends with my dentist. And so at the time, I had switched over from all the biomedical engineering field to business. And as I was going to school, my friend who had his own practice now was asking me for help. How do I fix this? How do, what would you recommend on this? So as I was learning all the content in school, the theory, right, I was able to apply all of that in his office. I was just
Nice.
practicing, and it benefited him and it served the purpose of growing the practice. And I kind of got stuck in the industry by accident, but it's definitely an industry that has had a lot of growth for me, a lot of learning. It's taught me a lot of things, not only in sales, but how to manage people, how to, work with financials, accounting, all of that good stuff.
So before we start talking about practice growth and how to achieve the consistency in growing the practice, what do you think are the top 3 challenges in 2025 that practices are seeing? Because you still work with a lot of practices, so I would love to hear from you. What are the top 3 challenges that you think that practices are facing?
I think from what I've experienced in the past few years and leading into 2025, there is not enough consistency in offices. And what I mean by that is there's a lot of people coming in and out as far as employees goes. They don't stay long. They don't like the industry. They go find another job that pays them a little bit more.
Too much turnover.
Yes.
Yeah.
Number two, we are in the age of AI now, right? However, a lot of the dentists who own practices right now, they are baby boomers. And so most of them kind of don't want to go that next step and, basically grow the practice via technology. So they're still scared. They're still scanning paperwork. They still have paper charts. We need to overcome that.
There is a resistance to
Yes,
technology.
to change.
Okay,
Yes.
resistant to change, resistant to technology. Okay.
Yeah. What would be the third one? Third one, and this is kind of like leading on to the topics that we're going to talk today, would be not enough training in sales for all people in the office.
Awesome. So what was the first one again?
Consistency.
Consistency, standardization in the practice,
Yeah,
basically,
skills
right?
and consistency.
Okay. Good. So let's let's jump into the topic today. That
Sure.
topic is super interesting for me because I got asked, like, hey, I do 20 patients a day. We spend a lot of money in the marketing, and we were able to bring in additional 10 patients per day. But what it uncovered for us was, okay, I was seeing 20 patients a day. It was uncomfortable enough for me to see that many patients per day. But when we brought in like 10 additional patients, we were staying till 8:30 in the evening. Things that we started to see we never thought would be a roadblock for us when we're trying to do. So what would you say? What do you see when people are trying to grow? How do they make sure they don't have these roadblocks? What are the roadblocks that
Yeah, that's
usually comes in?
yeah, that's a great question. So that goes back to the very first thing I mentioned,
Mm,
the scale and consistency.
mm,
So you have a front office that is going to have to answer phone calls. It's
mhm,
going to have to verify insurances.
mhm.
It's going to have to schedule
Yeah.
patients. It's going to have to recall patients who have not come in a long time.
Mhm.
It's going to have to try to fill up the schedule because there was cancellations.
Yeah.
Is going to have to intake forms, take payments, etc. But there's no
You have a superhuman in your front office,
yeah,
right?
absolutely. And this is typically managed by maybe 2, 3 people if you're lucky.
Yeah.
Some offices do have a person's, per role, and that's great. But most offices, you're going to find that they do not have that setup. Whether it is because there's more practice, or because they just don't want to spend
They
more
haven't
salary.
achieved the growth
Exactly.
to afford that kind of front office staff that they need to have.
Yeah,
Correct?
absolutely.
So you have one person just doing insurance verifications. You have
Yeah.
one person discussing with patients, like scheduling them, rescheduling them, checking in, making sure the paperwork is done, right? And then you
Yeah.
have maybe somebody who's just taking payments and making sure the payments are entered properly, and doing the calls for treatment
Yeah.
plan, pending treatment plans, and all that stuff. Okay.
Correct. And this is not to say that you could have a front that is cross trained. That's always great.
Yeah.
Somebody calls in,
Yeah.
somebody else is able to step in. However, when you don't have that skill and consistency, the proper training of the front staff on how to handle the same call, but same people need to answer it the same way, right?
Yeah.
For example, what are your fees? That's the
Mm.
number one question you get on the phone. What are your fees? Instead of giving them a fee outright, the front needs to know how to answer properly that question, how to address the concerns that patients may have, like how long is this going to take, how much is my insurance going to pay. You need to have consistent answers for all of those questions. The front also needs to be trained.
Do you think documentation is the answer for that? Like, document everything that needs to happen. Like, if somebody calls me, I know there's a document that tells what is
Yep.
the fees for each, right? Or don't answer that question.
We
That is part of the documentation.
yeah, we
Right?
typically don't answer that question. What we
Uh-huh.
want to accomplish is bring the patient in
Correct.
to show them on the screen, if they need, a root canal, whatever it is. It's easier to see it than just tell the patient over the phone, hey, it's going to cost you, I don't know,
Yeah,
$2,000.
the way I see that a good answer, somebody calls it like, hey, what's the cost of getting a cavity done for my son, right? So I would suggest that documenting good answer would be like, hey, we got to diagnose and check to see what
Yep.
type of filling it is, what tooth it is. So
Yep.
it's all depends on your diagnosis.
And if the patient pressures you can give them a range. You can say,
Yeah.
it could cost as little as $100 to, I don't know, whatever fee is,
Yeah.
$400 or $500, depending on what it is. But yeah, so that
Having the
consistency,
documentation for the front office is part of training.
the training, yes, how to answer those complex questions. And also, what we like to do in our practice, we like to have them train also on the clinical terms in the back,
Mm.
because you'll have a lot of new personnel on the front, and they'll come in and they don't know how to answer basic questions as to what's a filling, if
Yeah.
they're new to the industry. So they need to know how long is that going to take, what are the benefits of doing it, what happens if you don't do it. So clinical terminology is also important that the front is able to speak to in the calls.
Absolutely. And that helps, because if somebody knows, like, oh, we need to get diagnosed before we can give a price, then
Yep.
they need to see how do we diagnose, what do we diagnose. Yeah, absolutely. Because the number one thing that I see is that front office coming and asking doctors 15 questions. Like, I got this patient on the phone, doctor. They're asking for a price for filling. What do I do? So if you have that all part of the training consistent, and you have a documentation in place, and whoever joins, they go through that training before they come and sit in your front desk, I think that resolved that roadblock of growing the practice, right?
Yes.
That resolve the roadblock of taking your practice to the next level. And what I like these days that happens, Daniel, is that technology enables you to record all this as videos, like we do in our practice,
Exactly.
in our businesses, right?
Yeah.
So we record that in a simple Zoom recording.
Yeah.
And you just explain and you welcome the employee with the recording, and then you tell them that, hey, this is your role is going to look like, and these are the practices that we do, and this is, so you basically have like a documented video recordings of maybe 2-3 hours where your office manager can record it, or a super experienced employee can record it, or dentist himself can do like 5-minute recording on each topic. Put that in a folder in your computer. Whoever comes in, they have to complete that recording before they can start on a day one.
Absolutely. Technology has advanced so much that
Yeah.
we're able to have those standard operating procedures in a video format to where,
So if
you know,
somebody asks like, hey, where do I enter the payment in EagleSoft when I'm charging the card? You have that.
Yeah. You have a
recording.
library
You
of
have a
audio
library,
recordings.
and they
Yeah.
can quickly read that, listen to it, and then they will be able to take without having to, because the biggest asset in the practice I see is the time of the doctor.
Yes.
The time that he can, be with the patients, take care of the patients, the more, the more revenue and the production happens.
Yeah. And so another point I want to make about why is it important to have the staff trained properly is the doctor is going to be potentially spending thousands of dollars in marketing.
Yeah.
Whether it's ads, whether it's the website, whether it is SEO.
So how to answer the phone, basically,
Exactly,
right? Yeah.
because they are going to be the first person that a potential new patient is going to talk to. If your front staff doesn't know how to answer properly, you are going to immediately lose that patient.
A lot of money is wasted like that, I
Yes.
can tell you.
Yeah.
I can tell you a lot of money is wasted just because doctor is, the practice owner or office manager wants to bring in new patients. They do a lot of advertisements,
Yeah.
and they spend money on Facebook, Google. They get calls. Their people are missing calls. They don't answer the calls. If they answer the calls, then they don't know how to answer the questions they get.
The consistency to the
Yeah. So
answer.
if somebody calls in and asks question like, hey, I need to get braces. Do you guys do braces? Whether you do it or you don't do it or whatever it is, there should be a standard answer on how to answer that question, right? Sometimes people just call for second opinions, but
Yes.
that could turn into a revenue, right? Hey, I want to come and see if the doctor is available tomorrow because the other doctor told me that I need to get a root canal done. How do you answer that question, right? So there should be a standard procedure for getting somebody into the office. The first thing you train people is like, what is the right way to answer that question so that the person thinks that he's welcome to the practice.
Yeah, and sometimes that even requires for the front staff to know, if obviously if the doctor allows it, for the front staff to know that they can offer a free limited consultation.
Yeah.
If it's somebody who wants a second opinion or they're in pain, you can bring them in. If money is the issue, you can still bring them in.
Yeah.
Show them on the screen the X-rays, the reasons why,
Mhm.
and then worst case scenario, you're gonna find somebody who's thankful to you, even if they don't do the treatment, and they could potentially refer somebody in the future as well because you treated them nice.
One thing that I will tell you, this is something that I've learned talking to some of the doctors who see a lot of patients, and the time that you invest with anyone to help them out,
Yeah, it's valued.
the professional help that the doctors provide, it doesn't go waste.
Yeah.
It is going to come back to you. Maybe not now, maybe in 2 years, 18 months, 5 months, 2 months, we don't know, but it does come back.
Yeah.
And the way it comes back surprises everybody.
Yeah, we've seen that a lot in our offices.
Yeah. So I think it's just a good heart and open arms that makes a huge difference in
Yeah.
the profession.
At the end of the day, yes, dentistry is a business, but it's a business in which we are able to help people. And so by extending that help, like you said, it's going to come back in the future.
Yeah. What do you think about AI, role of AI, basically answering phone calls so you don't have a missed calls in the office and trying to answer patient questions? What's your take on that? I have seen some people really like it, some people like, oh, scared about that. What's your take on that?
Yeah, so I am really a early adopter of technology, and so I love AI. I
Okay.
think that AI, yes, it might have its limitations, or there might be some reasons for people to be scared. Totally fine. However, I think that we need to find that balance in which we can utilize AI as much as we can to free up time of our offices, and at the same time offer that consistency, that standard of care that every patient is looking for. It's easy to obtain that nowadays. Whether it is through a service like Zaha AI, for example, that's able to answer patients' inquiries on the website directly, and it's learned already some language models that it's tailored to the dental industry. That's great.
Yeah.
If we can have somebody else take care of that and it's doing it with quality, why not?
Yeah, absolutely. And the statistic says that 13% of dentists fall in your category. They're early adopters.
Oh,
They,
perfect.
they want to they want to try out. They want to see what the hell is happening here,
Yeah.
right? And then they make decisions. But what I say is that if you're missing 5% or more of your calls
That's
in
a
a
lot.
month, right? So if you get 1,000 calls and you consistently miss more than 50 calls a month, I think it's a good thing to try. Just try it out. No?
Yeah.
And
So
because you don't know what you're missing.
yeah, and there are systems that we can utilize to say, if everybody's busy in the front with a phone call or attending to a patient, the text message can be automatically go out to say, "Hey, Mr. Patient, sorry we missed your call right now. We're gonna give you a call back as soon as we're available."
So follow up with a text message
Exactly.
if you miss a call.
Yeah.
So at least having that part in the office helps, right?
Yes.
So you get a call, not able to answer, but you send a text message immediately.
Yeah.
And most of the people call from their phones. They don't call from landlines.
Exactly.
They're not. So yeah, that's good. So I do think so. mConsent does have something like that where you can get a text message, or the Zaha AI can definitely help with when you make call. The practice doesn't answer, there's the AI that answering, and it does say that it's an AI, so that the person on the other side knows that it's talking to AI. But to my surprise, the depth in which the conversation can happen between a patient and AI, man, it's mind-boggling.
Yeah.
It's just like when I saw it for the first time, I was like, wow, this is really interesting.
Sometimes they answer better than a human.
No, what it knows, I'll tell you what it knows. It knows how to schedule a patient.
Yeah.
It knows how to get a patient to schedule and come into the office, or make a commitment to bring them in, having them committed to come to the office for. So that is something I think is interesting about having this trained AI that works. I think it does work better than sometimes
Yes,
human interaction.
and also consider the fact that a lot of the AI appointments that you're talking about happen at night when
Yeah, I
nobody's
mean,
at the office.
of course, and
So
who doesn't want to be able to call an office after 7 o'clock when you're driving back home and you remember, oh, I need to take my son to an appointment tomorrow, and but nobody's there at the office. You still make a call, you leave a message, or you try to schedule online.
Yeah.
You know, all this. If you have, the more you have options you have available, I think it's better for the practice to achieve that growth.
absolutely.
So consistently growing, we talked about, before you even try to grow, we talked about what are the, some of the leaks that could happen in the practice where you're spending the money, but that money is not getting realized because you're missing the calls, or you're not able to have a right conversation with the patient, and they are not able to, bring them into the practice or schedule them into the practice. Let's get into next phase of this, where let's say all this holes are plugged, and you're now ready to bring in more patients in the practice. What challenges do you see coming in next?
Great question.
Let's say if you're trying to grow by 30%, what are the challenges
Yeah.
that you're going to see?
So everybody in the practice needs to learn sales.
Mhm.
They need to learn how to sell.
Yeah.
And by nature, people who work the front or clinical assistants, they are not salespeople.
No, they're not trained salespeople. For
Yeah.
sure, they're not. You're bringing someone who have worked probably at as a barista, or
Yeah,
somebody
exactly.
from different industry. And first of all, they don't know about industry. Second, they need to learn how to get people. You can find one of those personalities that are very outgoing,
Yeah.
and they know how to sell, but not everybody does. So what sales programs will you put in the practice? Let's put it that way.
So let's start with the basics. When we're talking about sales and trying to train our staff, number one is going to be avoid your own biases. And the reason why is, I'll give you an example, maybe about when I was actually first starting in dentistry. There was one day I'm at my friend's office and his treatment coordinator is not there. He has a lot of patients. Nobody's available, and he says, "Hey, can you help me present this treatment?" I'm like, "All right, sure," but I'm young in college, And I come in into the room, to the treatment room, and I see this treatment plan. I don't remember the exact amount, but we're talking about full on sixes, dentures, and it's like a $40,000-$50,000 surgical plan, right?
Mhm.
And I'm sitting here and I'm thinking to myself, how am I going to come and present this treatment to this person who just retired?
Mm.
You know? And I'm making the assumption that this person, in my own mind, I'm making the assumption that this person doesn't have the money to cover this treatment. And how am I going to give her the bad news?
Mm.
Right? 50, 40, $50,000, a lot of money. So I come in, I start talking to the patient, and I go over the treatment, tell her this is the amount of money that it's gonna cost. And to my surprise, she goes, "Okay, that's fine. When can we schedule it?" And I'm like, "This is my tuition for the year." You know
Yeah.
what I mean?
Yeah. Yeah.
So I am thinking to myself, this is too much money. I'm in college. This is my tuition for the year.
Yeah.
But I didn't know that this patient had been saving all of her career. Now she's retired. She's taking care of her kids. And now she decides that it's time for her.
Yeah.
And she has her 401k money to pay for this.
So
So,
basically, you have your own biases.
yes,
Don't get played into it,
don't.
and just follow the script.
Yeah. And this
Right.
is true for a lot of treatment coordinators because they'll come into the room and in the same scenario, they think it's a lot of money, but it's a lot of money to whom, right?
Mhm.
Patients make arrangements sometimes. Patients can finance. Patients can, do a lot of things to be able to cover the cost of treatment.
Yeah.
And you got to remember situations when it costs a lot of money is not something that has happened. We haven't gotten to that point overnight. It's been probably years of not taking care of their smile.
Yeah.
And so, we can help them via treatment plans or whatever you have in your office, but don't make the assumptions that the patient cannot pay. That's gonna be number one. Number two is going to be, how do we upsell?
Mm.
So again, the patient's already in our practice. How can we maximize the revenue that's going to come in from that patient? And it could be something as simple as, I'm on the phone call with a orthodontic patient who wants to put braces on, right?
Mm.
And hey, Mr. Patient, you know what? We can put the braces on tomorrow after your consultation. So the fact that that patient doesn't have to come back for an additional appointment to place the braces or pull their kids out of school, miss work, all those things are going to give you value added. And
Excellent.
so a lot of our staff is not trained to provide that value added. If I see a family who are cash paying patients and one of them needs an appointment for a cleaning, Mr. Patient, you know what? We have a family plan. If you schedule all of your family to come in for an appointment, we can reduce the cost to this. Let's bring you all in. So now you gain.
That's excellent point.
So now you gain 5 people in the family, and one of them's a teenager who needs braces. So you're maximizing that potential revenue as well. But this doesn't happen unless we train our staff to do it. So those are
So your
samples.
staff need to be trained, and they need to. So one question that comes to my mind is that, have you seen any kind of staff bonus programs or commission programs that could work when events, because you need to incentivize your staff, right? So if a staff is really really good and they can turn any patient into like 2 3 appointments, because if I have a family of four and they remember the stuff that, okay, his daughter didn't came, and she checks it and she makes sure
Yeah.
that she's trying to pull in some more appointments for you. Is there, have you seen an incentive program that works?
There's many of them.
Okay.
Every office is a little bit different. And funny, I was asked that question earlier today. Um, some offices use the traditional method. If you hit X amount of dollars in revenue, 1% or
For
1.5
the front office.
for the front office.
Okay.
For treatment coordinators, you'll have things like, for every case you sell, you'll get X amount. For the front office, in terms of, for example, orthodontic offices where you also have general, what they'll do sometimes is, for every new orthodontic consultation that you schedule and they show up, there's a pool of money that goes, and you guys get to divide that at the end of the month. So there's many different ones. I've seen offices who pay as little as $200-$300 a month per person, to offices who pay them almost $5,000 a month, just depending on the size of the office. So
Size of the office,
Yeah.
what they do, what services they offer,
course.
and what are you able to upsell on.
Yeah.
Right. All right. Good points. Anything else?
As far as sales goes, just be consistent with that training, and you have to keep talking about sales with your staff.
Mm.
Because if you don't, then
And when do you do that? In morning huddle meetings, or you like have like a dedicated Friday afternoon meeting to do this stuff. And who talks about it? Is it usually the dentist owner, or is it the office manager who talks about that?
It depends on their involvement. Typically,
Okay.
you want the doctor to be the one who leads this conversation because he's the owner of the practice and he has a vested interest.
Mhm.
But most of the time, it's going to be the manager who has to remind them, hey, let's ask for reviews. Let's talk about how many more patients and their family we can help. Let's talk about,
Is this every morning?
it has to kind of be every morning. People
Okay.
forget.
Okay. Okay.
People
No,
forget.
the reason I ask is that if you put the in your morning huddle, if you put this as part of your morning huddle, right? 15 minutes, right? You meet let's say you meet at 7:30 every morning and you discuss the practice analytics in the morning, 7:30 to 8:45, and then you have a schedule to discuss how the production was, all the performances and any open cases. You discuss all that, but you can say that okay, 15 minutes. This person is going to talk about this 8 o'clock to 8:15, and that could happen. And the one thing that I've seen that works in those cases is that you allow people to discuss what have they done yesterday or they like in last few days where they think it's a best practice and let
Yes,
them share it.
you could do it in the morning and you can also do role play
Okay.
because you'll get people comfortable talking about money. So traditionally in the American culture, you don't talk about money, right? You
Yeah,
just don't talk about
it's
money.
it's uncomfortable.
Yeah. So we're not used to doing that. And so we have to, in a dental office, kind of get people used to talking money because it's going to, at the end of the day, impact the bottom line.
Yeah.
If we're not good at upselling, if we're not good at just maximizing that revenue with our staff, the doctor's not going to do it. He doesn't have time. He's doing crowns in the back, right?
True.
The manager might be on a phone call or billing or whatever they're doing. So it has to be the front staff who does it.
So the next organic question that comes to my mind is that is there a place where these people can go get trained, like, or any programs available online, on site? What comes? What do you think is the right thing to do for someone who's listening to this and saying, "Oh man, I need to invest into some sales training here for my staff"?
Yeah, there are a lot of programs out there. Again, we are in the age of technology. So even if you were to give some prompts to Chat GPT nowadays, you can get most of the content.
Uh-huh.
There's a lot of YouTube content out there on how to sell.
Okay.
You can follow doctors who talk about this specific issue on YouTube or on Reels, even on Instagram. So content is not an excuse. If you want to
Okay.
spend money on it, sure. There's a lot of programs out there that you can simply Google and they'll pop up right away. But there's a lot of free content that you can start with as well.
Yeah, what I like to see is that some kind of a template that talks about incentives that a practice can take it and say, okay, this is a template. Somebody have used it. Let me try it.
Yeah, we can
And
link something on the notes.
okay, great, great. And if you can put something and say that, hey, if somebody does this, this is 2%, 5%, 7%, whatever that is, makes sense. And how can we make it easy where a practice listening to this and say that, okay, let me just download this, play with it, and see if this works for my practice,
Sure.
right?
We can.
It's all about experimentation because the more you try, the more you learn. You'll find new things.
Yeah.
That was insightful, man. Thank you. What else?
Okay. So another roadblock that we can talk about would be metrics.
Okay.
If we're not measuring our conversion rate for treatment plans, we do not know what we're doing.
Okay.
Simple as that. And it goes back to the fact that
So you're talking about the conversion of if you offer 10 treatment plans a week, how many of them are actually coming and becoming your patient and getting the treatment done?
yes.
Okay.
And the reason, and it could be for any practice or specialty. It could be general, ortho, pediatrics
Yeah.
for sedation cases, for example, whatever it is.
Mhm.
And the reason why is because if we're not converting most of those patients, there's a disconnect somewhere in the system.
Yeah.
So in order for us to find what's not or what needs fixing or how we can improve things, we need to be able to measure. And so if in an orthodontic practice we're getting 30, 40 new consultations every month, but we're only starting 5, 10 cases, there's a big problem. Because most of those cases are people who want braces, who already did the research as to why they need the braces. And so we need to be able to sell most of those treatments.
Yeah.
And if we're not measuring these things in our practice, then how can we know if we're doing well or how can we know what we need to fix? The other thing is going to be when our front is scheduling, are we scheduling to maximize the revenue, or are we simply scheduling to stay busy?
Um,
Right? Because front staff typically, the doctor can be upset and be like, "Hey, how come my schedule's not busy enough?" And what they'll do is they'll go and try to book the easiest appointments to book, which are going to be cleanings for the most part.
yeah,
And so you could be really busy, but you're not producing enough money. You're staying afloat.
yeah,
So, what are the main, I was going to say codes, but what are the main treatments that are going to bring us the most revenue? Your general practices? Is it crowns? Is it implants? Is it, deep cleanings? Do you have a hygiene program established or not? Those are the type of things that we need to keep an eye on and correlate that to our schedule. Is our schedule booked with those type of treatments, or is our schedule just booked with hygiene and or cleanings and things that are gonna make me pay the bills but not help us grow?
so basically, making sure that you have a good mix of who you are actually looking to schedule in your practice. Like,
Yes,
you don't want to just become a hygiene office, and a doctor doing hygiene stuff
exactly.
is not very productive.
Yeah.
So, how do you bring in the right patients? How do you bring in the right treatments?
How do you schedule them?
How do you schedule them?
Yeah.
Yeah, that's amazing insight that I think people would appreciate it from you, because every time you hear like, I don't have enough appointments.
Mhm.
Sometimes it's just better to have two and good ones,
Yeah, exactly. If you
right?
can make $2,000-$3,000 in one appointment, it's better than
$200.
20 appointments of hygiene.
Yeah. Awesome. So that was those were my questions, and I think that these are the real insightful conversations on how do you not get stuck, with the practice growth. And these are some of the great strategies that you have shared. Is there anything that you would like to add to it, or anything that you think I should have asked, about not getting stuck when you're trying to grow as a practice?
No, so don't be scared. If you're a dentist, do not be scared of technology. It's out there to reduce the friction. We have a lot of complexities in the dental industry as it is. For example, we're always fighting with insurance to get paid, right?
Mhm.
So we're spending hours and hours trying to verify the insurance, getting all the details
Yeah.
so that we can collect accurately from the patient and from the insurance. But don't be afraid of the technology. There's a lot of companies.
Not just technology, but what I think is also important to think about is that if you're seeing 20, 30 patients and you have someone just doing verifications, nothing wrong with that. But is that really worth it when you know that you can outsource this for
Exactly.
$500 a month,
Exactly.
right? And they will do a better job. They'll be more consistent. They can give you what you're looking for. Initially everybody have hassles
Yeah.
that you just have to figure out, is this something that I want to focus on?
Mhm.
Is verification something that is core part of my business? My core part of any dental office is that person comes in and he goes smiling. Like, you make the smile better rather than verifying the insurance. So the core, is that the core part of your business? If it's
Right.
not core part of your business is not doing documentation. Core part of your business is not billing, sending
Scanning.
claims, scanning,
Yeah.
documentation, but
So the
the
goal
core,
is to reduce all that, right?
and focus on
Patient
treatment
care.
plans,
Yeah.
patient care, getting them get more and more treatments done. So that's insightful, Daniel. Thank you so much for putting time into going into details and explaining on what it needs for a practice to grow consistently, and what it needs for a practice to take it to the next level and not staying stuck with the problems they're facing. So that's amazing. Thank you so much for being on this show and being on this podcast. We will bring you back, and we have a lot more topics, a lot more questions, and we're glad that you have been able to make it today. And thank you so much for coming in.
Thank you for having me.
Thank you, Daniel.